Welcome back to COVID-19 updates. In today's video, I'm going to be talking about there has now been an increase of 3,100 cases on Tuesday. There have been more than 370,000 confirmed cases of coronavirus so far in the UK, and 41,000 people have died, government figures show. However, these figures include only people who have died within 28 days of testing positive for coronavirus, and other means suggest the number of deaths is higher. Cases rise amid concern over hotspots. The government announced 3,105 new cases on Tuesday, continuing the trend of newly reported cases hovering around 3,000 each day. Recent days have seen the highest daily cases since mid-May. The new rise has prompted the government to reintroduce local restrictions on social gatherings in England. Groups of more than 6 people are now banned from meeting anywhere, socially, indoors or outdoors, with some exceptions. Daily confirmed cases begin edging up in July after falling significantly from their April peak, as lockdown restrictions imposed in March were eased. The official number of cases during the peak in the UK underestimated the true level of infection at the time, as widespread testing was not available until mid-May. Before then, testing was targeted, mainly being used in hospitals and other care settings. The rise in cases since July can be partly explained by increase in testing. If you are testing more, particularly in hotspots, you are likely to find more cases, but the most recent estimate for the Office of National Statistics, the ONS, suggested that the number of infections has increased in recent weeks. The latest survey from the ONS released last Friday estimates that 1 in 1,400 people in England had coronavirus. The figure from the previous week was 1 in 2,000. Based on tests in household for current infection, the survey is thought to give one of the most accurate pictures of whether or not cases are rising. The apparent rise in cases since July has not so far translated into a significant increase in people being admitted to hospital. So which areas are on the watch list? There are several local hotspots in the UK which have seen a spike in cases since the nationwide lockdown ended. Public Health England produces a weekly watch list of areas of concern based on the assessment of incident rates and other indicators such as trends in testing, healthcare activity and deaths. Burnwell, Sunwell and Solihull are the latest areas to be designated areas of intervention. A ban on households mixing within all 3 areas came into force on Tuesday after affecting about 1.6 million people. Rossendale, Burnley and South Tyneside are among the areas designated as areas of enhanced support, meaning that the government will work with local authorities to provide additional resources, such as testing or contact tracing, to help bring the numbers of infections down. In Scotland, restrictions on household mixing have been expanded from Glasgow, West Dunbartonshire and East Renfrewshire to Renfrewshire, East Dunbartonshire and North and South Lancashire. In Wales, the county borough of Caerphilly has been placed under local lockdown, and in Northern Ireland, restrictions on visiting other households has been reintroduced in Ballymena and Belfast. The daily deaths are not changing. While the number of new confirmed cases of coronavirus has been rising again recently, government-announced deaths have continued to fall since the peak in mid-April. On Tuesday, the PHE announced 27 further UK deaths, 25 in England, 1 in Northern Ireland, 1 in Scotland. No new deaths were reported in Wales. In August, the death toll in England was reduced by 5,340, following a review of the way the coronavirus deaths are counted. New rules mean deaths anywhere in the UK are included in the coronavirus total only if they occurred within 28 days of a positive test. Previously in England, all deaths after a positive test were included. England has seen the majority of UK deaths from COVID-19 using the 28-day cutoff. They have been just under 37,000, but the overall death toll could be more than 60,000. When looking at the overall death toll from coronavirus, official figures count deaths in 3 different ways. Government figures count people who tested positive for coronavirus and died within 28 days, but there are 2 other measures. The first includes all deaths where coronavirus is mentioned on the death certificate, even if the person has not been tested for the virus. The most recent figures suggest there have been between 57,000 deaths by the 4th of September. So if it's deaths within 28 days of a positive test result, there's been about 41,664. Death certificate mentions COVID-19, 56,846, and deaths over and above the usual number at this time of year, 64,024. The third looks at all UK deaths over and above the number usually expected for the time of year, known as excessive deaths. The measure shows the death toll was above 64,000 by the 4th of September. There were just under 9,000 deaths registered in the UK in the week ending 4th of September, 1,400 fewer than the 5-day average. These figures from the ONS also show that for the first time since March, there were fewer than 100 deaths in a week in the UK, mentioning COVID-19 on the death certificate. The government has argued it is too soon to make definitive international comparisons, but as the impact of the first wave becomes clear, analysis